Welcome to the Sydney Adventist Hospital, otherwise known as the SAN. My name is David Hale and I'm head of the Sydney Clinical School at the Sydney Adventist Hospital. Now, a lot of people wonder why it's known as the SAN. Well, it started back in 1903 as a hospital for treatment of TB. And this is one of the original buildings at that time. And it was surrounded even by a dairy and gardens for the treatment. And over the last 120 years, it's changed from a tiny cottage hospital essentially to the biggest private hospital in New South Wales. This is the centre of the village green, which is the centre of a lot of community activities. And behind, you can see the Clifford Tower, which took over the site of the original sanitarium hospital. And in the last 20 years, we've had the SAN Clinic over here being built, and then in between it, the massive Clark Tower with all of the modern facilities. So this is the Stan Dunlop hub, which connects the two main towers of the hospital and also with the rest of the facilities such as car parking and the SAN Clinic. So the Clark Tower has the surgical centre, and as well as that upstairs there are a number of floors of wards, including intensive care and the birthing unit. So upstairs we've got 19 operational theatres that perform over 20,000 procedures per year. The theatres run for 24 hours, 7 days per week.
We are currently in an operating room. Welcome. We predominantly use this room for orthopaedic surgery and cardiothoracic surgery. So you've probably never seen teamwork like an operating room. So many different roles, so many different areas and specialties. My role is to support our students here when they come and visit the SAN. And as a student, you will be observing lots of surgeries and often have the opportunity to scrub in and be involved in assisting those procedures.
Good day, guys. My name is Christos Apostolou. I'm an upper GI surgeon, professor of surgery at the Sydney Adventist Hospital. We have a wide variety of specialists that are keen to teach you. You'll be able to complete your portfolio items. So you're most welcome to come and join us across all disciplines. Of course, general surgery, which is my discipline, is the best. But you can also join our experienced colleagues in neurosurgery, orthopedic surgery, plastics, gynae, urology, and so on. And you'll be able to join us in theatre, scrub in, observe, ask lots of questions and learn a lot about surgery.
So we're now in the Education Centre, which is just down the hill from the major part of the hospital. So we've got teaching areas here, lecture theatres, and smaller areas upstairs as well.
My name is Annie. I work for ANU as the Clinical Skills Coordinator. We are in Lab 1. This lab is a lab that I have small groups of students, which works perfectly around 4 to 6 students, so they can get some really good attention in teaching. So the students get taught the skills here, but then they have an opportunity to practice in designated labs.
All of our teachers here, they're all staff members here. So if we see them here, they recognize us when we're in the hospital and they're more than happy to continue our education there. The first time we did a nasogastric tube was in these facilities, and then literally the next week we had a patient in the ED come by and was comfortable letting us perform a nasogastric tube on a real patient.
For me, there is nothing better than taking students up to the emergency department and watching them practice the skills learnt, and for them to succeed in their first cannula on a real life patient.
My name is Guru Prasad Nagaraj. I'm the Director of Emergency Medicine at SAN Hospital. It has this unique combination of being busy but yet very supportive. We do take time to teach the students, and that is sort of something which every student who comes through ED especially, they all really appreciate. And we actually sort of let them see patients, take histories, and be involved in the care.
Hi, my name is Sandhya. I'm a senior lecturer with ANU, and I teach clinical skills and simulation-based education. And I'm also an emergency physician working at the SAN Emergency. We are now here in the simulation lab. in our sim center. And this area of the simulation lab is our resuscitation bay or resuscitation area. What we do here is we replicate a real-life situation into a clinical scenario and let the students do their learning by actually performing things on the mannequin and analyzing clinical reasoning to see what is wrong with this patient and initiate management. And this is all done in the simulated environment, which is a safe learning space for the student. So now we are in our operating theater, again, another simulated environment. Essentially here the students learn how they can gown and glove. Let's say the etiquette of operating theater the students learn here.
We've been able to follow patients through their journey at the SAN, and it was amazing to be able to see patients in clinic and then see them at the birth of their baby as well, and how the patients were so willing to have us along for their journey here.
Hi, my name's Nancy. I am Senior Lecturer in Women's Health and Newborn Care. So when the students come to this facility to do their Women's Health and Newborn Care, they have a very rich variety of experiences. They will work on delivery suite. They will be an important member of the team and work alongside the midwives caring for women in labour. They will work in the special care baby nursery where unwell babies spend time, premature babies, babies that are sick while born at term. And they will work on the postnatal ward. They'll also spend time with the lactation consultant and spend time in the operating theatres. I'm very passionate about women's health. Approximately 50% of your patients in the future will be women. All of them will go through the full gamut of the reproductive system and the life cycle. So regardless of what specialties you're ever treating, at some stage your patient may be unwell with something else, but they may be pregnant, they may have a gynecological condition, they may be menopausal, they may end up with a gynae cancer. So it's a very, very broad topic.
Hi, I'm Natasha.
And I'm Liz.
And together we are
the education team at the Sydney Clinical School.
We coordinate all of the education opportunities here at the SAN.
We're often your first point of contact with, we send you emails and information about how to come to the SAN, what to expect. Follow that up with, once you arrive, we go through a full orientation with you.
We are here for you. We're very keen to offer students as much support as possible to make sure that the experience they have here is a good one. We really encourage students to come and be a part of our SAN fam.
What I reflect on is like all of us have been through the journey, and some stage there have been someone who has held our hand and like walked us through all the complexities of medicine. And that's what we want to give to our students.
They are committed to teaching, and I think that's the standout advantage of coming here, that everyone involved with the students wants to be involved with the students. They really believe in the quality of the future doctors that are being produced through our university.
I have learnt so much in my year here.
It felt like a big family.
Yeah, I think the SAN has been such a great opportunity for me. I feel no regrets at all coming to Sydney.
There is so much that you can learn from a place like the SAN, as well as other clinical placements.
Hopefully, we've given you an indication of the size and the scope of the hospital. It is busy with a broad patient mix and a wealth of learning opportunities. So when you're considering placement, why not say what they've been saying here for 100 years? Take me to the SAN. We're sure you'll enjoy yourself. We certainly do, and we look forward to seeing you soon.